Ladies and gentlemen, good morning and welcome to Gashi's Kaiman TV. Due to public demand, a number of our viewers has requested me to actually give an analysis about the signing of the health system, the health package between Kenya and the United States of America, whereby the United States of America is going to fund the health system with 1.6 billion US dollars within a span of 5 years. And they're going to bring the US model health system in Kenya, according to the US Secretary of State. And again, Kenya is going to allow the US to access the health data for the Kenyan patients. Ladies and gentlemen, I want us to observe a number of things. First of all, in this video, because here we have the Secretary of State, we have the Kenyan leader led by William Samoei Ruto. I want you to look, one, the way they are standing. Number two, look at the position of their hands. And number three, you look at the flags. You see the Kenyan flag sandwiched by the two American flags. And this is the body language. And before I give a critical analysis about what is happening here, ladies and gentlemen, watch this video briefly.
$1.6 billion in health assistance over the next 5 years. And you'll see how that program works out. But the investment is in combination. It will allow us, first of all, to leverage the private sector to create a sustainable U.S. health assistance model around the world, and not just in Kenya, but this is the perfect place to prove that it's going to work, because it is going to work. And what it means is that money is not just going to be spent to provide medicine and care, it's going to be spent to improve the domestic infrastructure, healthcare infrastructure, so that in 5 or 6 or 7 or 8 years, countries will say, we no longer need this much assistance, if any, because we have our own system, you've helped us to build it, it's now delivering results, and in fact, we now, these third, like maybe Kenya, want to go and teach other countries how to do it. And this is a very real possibility, and it's something we believe in. By the way, Kenya, our partner, okay, we're not imposing this, they're our partner. $850 million is what they're going to give to support these efforts. So this is truly a partnership. This is the way we should be doing assistance around the world. True assistance is self-sustainability, building the ability to sustain yourself in the long term. So it's an honor to be able to do this with you today. I'm excited. This is our first one. We hope to sign, I don't know, 30, 40? How many? 50. Okay, well, this is number one. We'll always remember this one. You always, the first one is the one that, and we think we've picked the perfect partner. I thank you for being here today. I know you're also here. You're going to join us in a few minutes over at the Institute of Peace for another important topic on the Democratic Republic of Congo and Rwanda. So we're grateful you're here for both of these things, but it lined up perfectly. We are honored to welcome you to the State Department, Mr. President, and thank you for joining us today. Thank you.
Thank you, sir. Thank you.
And if you have never subscribed to this channel, please, I request you to subscribe to this channel. And for our viewers also at this juncture, I request you to like the video. Now, the issues that I want to raise here is about the data protection. We have the data protection law in Kenya. Is the government going to infringe on this? Because you see, when you expose the details of Kenyans to a foreign country, then Kenyans are likely to ask hard questions. So I think Kenyans are likely to go to court and say that this is against the Data Protection Act. Number two is about the business of data mining. Data mining is the most lucrative business in modern day Kenya and in the world today. And everybody is trying to mine data to do something. And I think the pharmaceutical industries that are there in the US, they could be trying to mine the diseases that could be ravaging Africa so that they can actually manufacture drugs. They can be able to come up with maybe even generic drugs that can treat some of these diseases, or they can be used to maybe create problems in this world. Remember, you can have even biological war where we can actually manufacture some of these things. I don't know why they cannot use the Americans. And you see, if you remember the policy of America and Donald Trump in particular, it is America first. America first. So anything that you see America doing, the interest should be America first. Because you see, when you listen to the Secretary of State, he's talking about partnership. So he's trying to defend it. He's trying to show Kenyans and the world that they are not forcing it to Kenya. They are in partnership, and they are saying in future, maybe other countries are going to learn from Kenya, and I think they are saying within a span of 8 years, Kenya is going to be a very different country as far as the health system is concerned. Now, the other question that we should ask ourselves, this is something that is being tested in Kenya for the first time, and it has never been tested in any other country. So are we using our country, are we using our state as a guinea pig? Why start with Kenya? Why has Kenya become a testing ground in anything new? Remember, the other day we saw the issue of GMOs being forced on Kenyans, and I don't know how far we have gone above the issue of GMOs. I know the GMOs are with us, but the laws have not been properly put in place. So when you look at the president, the president swore to defend the constitution, and why should we not say Kenya first? Because here, when you look at it, we are catering for the interests of the American. Now, there is also this issue about the huge amount of money. $1.6 billion is a lot of money. Can we trust the government with this money? With corruption that sticks to high heaven, can our institutions be trusted with this? Can the government be trusted with this? Because you see, some of this money, maybe the American may have good intentions, but the money could end up in people's pocket, considering that we are headed to the election where money is actually the main commodity that is being used to buy votes. There's also the issue of the strong institutions that the US Secretary is talking about, and government structures and so on and so forth. But when you look at it, really, do we have strong institutions in Kenya? Really, do we have strong institutions in Kenya? Because they leave a lot to be desired, if you ask me. The governance issues are also issues. When you look at our democratic gains that were there, we are very busy destroying the gains that were put there by the other regimes. And that's why we have to raise hard questions when the American start saying that we have strong institutions. I don't think we have better institutions than South Africa. I don't think so. And when you look at it, you say the heart of USA here, it means that they can be able to control us. Are we still those kind of people who believe that there's nothing we can be able to do on our own unless we depend on the American government? However, it is also good to look at both sides. If it works, it is going to be very good for Kenya. Because you see, the idea is to bring the American system of the health system, they're going to bring such infrastructures to, they'll be actually escalated, they'll be constructed, the facilities, the testing laboratories, they'll be done in a way that we are going actually to, it's like we are trying to actually duplicate what is in America, instead of now Kenyans going to India to seek medical services, so Kenya can become a model country. But are we really not able to actually put our health system in a way that we don't need to depend on these Americans? What do you think, ladies and gentlemen? And look at the coincidence. This is coming when at a time when we are also talking about the DRC, when we are mining gold. Remember, we mined a lot of gold, and remember what is happening in Okolomani. And remember, kule DRC, Uhuru alikuwa pale, nani alikuwa pale, the president was there, and we saw what is happening. So this coincidence also tells a lot, because it looks like it is not just coincidence of interest. What do you think, ladies and gentlemen? Would you trust the American government when it comes to this? Would you trust William Samoei Ruto's government? Guys, please like the video and have a blessed day. Bye-bye.